Everyone, good morning, good afternoon. Welcome to the 7th session of the GMF's on Turkey conversations. Today's focus will be on Turkey's coronavirus status, and this is the most respected and well-weighted topic in the agenda right now. I'm Ceylan Cambilek. I'm a senior program officer in the GMF's Ankara office, and I will be moderating today's discussion. We are thrilled to be joined by two experts, Professor Önder Ergönül and Professor Güven Sak. Professor Ergönül is the executive committee member of the European Society of Clinical Microbiology and Infectious Diseases, and he is with the Koç University School of Medicine. Professor Güven Sak is the director of the Economic Policy Research Foundation of Turkey, TEPAV. First, Professor Önder will shed light on the status of coronavirus in Turkey, country's response to the pandemic, and future steps. And Professor Sak, on the other hand, will address to what we can say elephant in the room, the economic implications. And we believe the success of these webinars lies in being interactive and informal. So what we plan to do is that each of our speakers will give opening presentations for 7 minutes, and then we will open up the discussion to your questions. For you to submit your questions, you can use the Q&A function of the Zoom, and this you can find at the bottom of your screen. And when submitting your questions, please state your name and your affiliation. And please note that the chat function and raise your hand function is not available for submitting the questions. This will be an on-the-record session, and we expect to end at 7 p.m. Turkey time. Now I will turn to Önder Bey, but just to note that we are going through this extraordinary crisis on all fronts: health, society, economics, politics, psychology, and this brings in the need for verified information and updates. So we feel that we are lucky, Professor Önder, that you are here with us to bring in this expertise. So over to you. And please unmute yourself before your speech.
Okay, thank you very much. Ceylan Cambilek, and hello everyone, and also hello to Güven Sak, co-speaker. Now I would like to share my slides with you first, and then we can have some questions. Can you see the slide now? Okay. Can you see the slides?
Yes, we can see it now, Professor.
I will try to summarize, give you an overall picture in few minutes, in 7 minutes, as Ceylan already said to me. Oh, sorry, that was in Turkish. I'm sorry that I put in I was in hurry, and anyway, so then I cannot use in Turkish slides, that I will just talk in my mind. First of all, now throughout this pandemic, we have some important problems, some significant problems, not only in Turkey, but everywhere. In fact, Turkey was lucky in many aspects. But overall, the pandemic hit the big cities of the big countries. If you look at the numbers for the case fatality rate, this is the number of the people who died because of the coronavirus disease. We call it case fatality rate. It's a percentage, as a proportion of the people who died because of some specific disease. So if you look at this number, for instance, in Italy, France, Spain, United States, Belgium has the highest numbers. And Turkey has 2-3% of the fatality rate, for instance, but it's about more than 10% in UK, Italy, France, Spain, US. So although we can talk about these proportions, is there any bias or any flaw in calculation? Also, we can talk about that. But in fact, if we look at we did some analysis why the case fatality rates are different in different countries. One of the most important reasons is healthcare facilities, access to the healthcare, and the number of the beds in one hospital. This was very important per population, of course. If your hospitals are enough to admit the patients, and if you have skilled healthcare workers and enough number of the ventilators in ICU, intensive care units, etc., these kind of countries managed much better, absorbing the people who need help. And this all happened in the big cities. For instance, in Turkey, Istanbul was the #1 city, whereas the rural area, if the population density is lower, then these kind of countries or rural area were luckier because in transmission of the disease, if you are crowded, I mean, if there is a crowded population, this is the main transmission way is person to person. So the person-to-person transmission is the main issue, and the droplet transmission is still the number one, although we are talking about the aerosolization and aerosol transmission. This is another discussion point. Still, we believe that the droplet is the main transmission way, and therefore, if a city is crowded or certain parts of the city is more crowded, then these are the risk areas. Like we have this in Istanbul, New York of US, Madrid of Spain, Milan of Italy, and Wuhan of China, kind of cities. These are the big metropoles of these countries. And then the other way is some risk groups, of course, personal parameters like age dynamics of that country, age pyramid. And if you have an older population, then the case fatality rate was higher. Also, if the age increases, a lot of comorbidities also increase. One of the most risky one is hypertension, for instance. And sometimes we think about that chicken and egg problem, age or hypertension. In fact, if you are older than 60 years of age, so then 60% of the 70% of the population has hypertension. So in our analysis, we found that hypertension is the most important risk factor, but also it includes the age parameter in itself. So these were very important basic parameters, basic things in terms of the getting affected from that such a global threat. It is to a number that we haven't seen such a global problem since the Second World War in terms of the fatalities. And then what are the other problems? So the transmission was still under discussion, under debate. Some people, to me, I believe that exaggerated that aerosol transmission. Of course, there are some aerosol transmission, especially in our ICUs, intensive care units, while doing intervening with the patient. Especially, we can accept this because there is an aerosolization. But for instance, if you are walking on the streets and if there is no people, if there is no crowd, it is no way to get the infection. But now people use masks, although they are alone in a long, big, white boulevard. Okay, that's no problem. Never mind. I mean, they can use the mask. That's okay. Turkish people, for instance, I'm talking from Turkey, and they easily adapted using masks, I believe. I use also the community transportation. When I was taking the metro, I'm happy to see that almost 99%, I can say. I can have a very quick statistics, and close up to 100% were using masks, for instance, yesterday. And so the transmission way, we should keep in mind, droplet is the number one, but aerosol could be. There are lots of studies, very nice, interesting studies. We are also involved in detecting the aerosols and getting the image of these aerosols. But another problem here was the treatment. And there is no effective way of treatment. And since there are, as far as I understand, there are people here who are from the political science or social sciences, I think there is a very interesting topic that we can intersect in here, the hydroxychloroquine. Trump recommends using the hydroxychloroquine, which is nothing. I mean, and I can see that Dr. Fauci has also having problems. Also, from the beginning of the pandemic, we never believe in the use of the hydroxychloroquine. This was the myth produced by a colleague of us from France. By name, his name is Didier Raoult. He published an unfortunate, totally flawed and totally nonsense paper. In normal times, it can never be published, but it was published anyway. Lots of rubbish was published. I mean, thousands of papers were published in last 2 months, 3 months. this is a shame. This will be something like how people can behave in a panic environment. I'm sure the science historians or social scientists are going to explore this kind of behavior. We had a hard time trying to convince our colleagues not to use this hydroxychloroquine for prophylaxis. We were saying that you can use any other thing. I mean, there is no any single strong or even weak support to use this. So still, there are two antivirals that we still think about, maybe weak positivity. One is favipiravir. It's a Japanese drug. Japanese were promoting this drug. Still they promote, they like this drug very much, and they use this drug in many other diseases like Ebola or Crimean Congo hemorrhagic fever, kind of hemorrhagic fevers. And also the other one is the remdesivir, which is promoted by a very big, large American company that produces antiviral drugs in HIV or in hepatitis B, hepatitis C, etc. So this is remdesivir. And it was explained that there is a weak evidence that remdesivir could be effective. There are two antivirals in total. And then the disease itself, interesting, has two basic compartments in terms of pathogenesis, in terms of process of the disease. First, the virus comes into the body and then replicates itself, reproduces itself, and then triggers a certain chain of reactions, a cascade. So in this cascade, a strong anti-inflammation happens. We call it a cytokine storm. Cytokines are the molecules in our body for the immunity, but here it's something like the body was falsely alarmed for a big danger, and then body itself create lots of that molecules and then try to destroy itself. So therefore, we need to stop this self-destroying, just like we did already for immunologic diseases like the rheumatoid diseases or some cancer diseases, etc. The idea is the same. At this point, it is not an infectious diseases, but it is a rheumatologic diseases. Therefore, many internalists, rheumatologists, and cancer physicians are also quite interested in this pathogenesis. So that some of the people, we don't know who, but some of the people are progressing at that level. Some of them are improved at certain position, at certain point, but some of them get worse throughout the course if you do not use anti-inflammatory drugs timely, and then will be moved to the intensive care unit. So we lost some of them. And in Turkey, my hospitals are good. I mean, I can say the best hospitals of Turkey. I'm sorry, but this is the case. So I'm responsible for the two hospitals in our institution as chairing two hospitals. And then our fatality rates are very low, but it's not representing the fatality in Turkey. But I can say, if you are admitted to the hospital, the fatality rate is around 10%, 15%, still serious. And then for the vaccination, finally, then I will finish because my time already passed, I think, sorry. So for the vaccination, still at least we have 6 months. The most optimistic time is 6 months, and even more, maybe one year. And even maybe at the end of the 1 year, we may have nothing. This is not easy. I mean, for the SARS, MERS, or other drugs, it takes years to develop an effective vaccine. So therefore, waiting for an effective vaccine is not very good or wise approach. But on the other hand, people learned, get aware about the disease. Physicians, nurses, the healthcare workers learned about how to overcome. And we are much better now in terms of overall global level. We are much more equipped. At least we learn how to protect the people, more or less. How are we going to do the interventions in the hospital, etc. Although we don't have any effective antiviral, we are much more experienced and now much luckier. And how it's going to happen now, after now on? Well, what we guess as a scientific environment in the world, not only in Turkey, maximum 20% of the people are immune. In order to stop the pandemic, we need to have 60% of the population to be immune. This can be achieved by the vaccination, but we don't have any vaccination right now. Therefore, in a natural way, these patients should have this infection. And if 60% of the population gets this infection, the spread of the pandemic will cease. But we are at the level of the optimistic number. For instance, I'm talking about Istanbul, Madrid, New York, kind of big cities, about 20% maximum, the most optimistic number. And even if you go to Ankara, for instance, or in in rural towns like in Central Anatolia, etc., it may go down to 5%, even less. Therefore, we have a long way to go on. This is the situation, finally. And then I can stop here. Maybe we will have some questions. Sorry for talking much.
Thank you. Thank you very much, Professor Ergönül. This is very useful. And let me just remind you that you can start submitting your questions. And Güven Bey, labor productivity, trade, agriculture, tourism, external finance, all in crisis. And I will just turn to you for further elaboration. Over to you.
Okay. So I don't know whether it's good to hear that only 20% has already been immune, so there is a long way to go. But let me say a few words about how we have learned about this process before talking about its impact on the Turkish economy. I was in DC mid-February. I remember discussing this issue of the virus or the COVID-19 in Wuhan at that time with many people about its possible impact on the economy, on the global economy, on the Turkish economy also. And as far as I remember from that time, this was in Washington too. It was a kind of a thing that's happening in some distant land, you know, in a faraway country. There was an outbreak. So at that time, we were thinking that it's not going to have this impact, that it's going to come to us, it's going to fly to us in one way or another. And at that time, I remember talking about the impact on the Turkish economy in a more positive manner, saying that, you know, the oil prices are going to go down. This may have a positive impact on the balance of payments situation in Turkey. So despite the policy mistakes in the Turkish economy that we have made, despite the policy uncertainty that we have had, it is possible to muddle through mid-February, I'm saying. So I was expecting that the impact could be milder, and through the global supply chains, there might be an impact that may, in fact, influence European production capacity in Europe. So that may indirectly affect us too, through our exports, a decline in exports. But it was something in a faraway country. But when it came to us, when it came to Turkey also, together with all those other countries, we saw that it's a totally different thing. I was thinking of showing some slides first, but I don't think it is useful to look at how the numbers, how the series are faring in the face of a crisis like this, because many of the things now, many of the numbers that we have now does not have any meaning compared to the situation that we are in at the moment. For example, you know, inflation figures, I mean, the consumption baskets have changed completely. Export figures are declining just because of the fact that nobody is, you know, could be able to send goods through countries, and it's not possible for people to come together and continue the production efforts in many sectors. So it doesn't have many use in making comparisons with the numbers. But the important issue, I think, is this. There is a steep decline in real economic activity everywhere. And I think this is the first sudden stop that we had seen in our economies that happened first in real economic activity. Because in the past, we have had sudden stops too. But in those cases, the problem usually started in financial markets. There was a problem in the financial markets. Then we'll see its impact on the real economic activity. But now, what we had seen, we had a sudden stop in real economic activity with financial markets left kind of, more intact and operational. And I don't know what they are doing, because it's very hard for them to do any kind of valuations in a situation where there is a sudden stop in economic activity. I mean, when you look at the numbers now, I said steep decline, but this steep decline in every figure is not happening only in Turkey, it's happening everywhere. In terms of growth, we know the IMF forecast for this year, it's -5%, but -5% means it all depends on, as Önder has mentioned, it all depends on the duration of this problem that we have at hand. Because if the virus is still going to be around for a lengthened period of time, then the economic damage is going to increase, because the economic damage is because of the measure that we are taking to contain the virus. It's social distancing that's leading to this damage in the economy, creating this damage in the economy. So if this thing is going to take more time, if this normalization, if social distancing is going to continue for a lengthened period of time, then the economic impact is going to be deeper. So when IMF says -5%, presumably they are thinking that this is going to end in 3 quarters and we are going to be back in 3 quarters. Because if you compare, for example, OECD's economic impact estimate, it's -24% for the Turkish economy. So you can say that -24%, let's say in one month, as there are 12 months, is going to be -2% for the whole year. If it is a quarter, so it's going to be around 5.5% to 6%, -24 for 1 quarter means. But if this is going to continue, let's say these measures are going to continue at the same intensity. With less intensity, then we need to make new estimations. But if this thing continues with the same intensity, the measures, the social distancing, let's say for 2 quarters, for 6 months, then it's, obvious that the economic damage is going to be around 10 to 15%, -10 to 15% in terms of growth-wise. That's why I think we have this constant discussion nowadays everywhere, starting with President Trump, about reopening. Because the longer the duration of this social distancing measure, physical distancing measures that we have at hand, the deeper the negative economic impact is going to be. And that means that the governments need to do more in order to support the livelihood in their own countries. Because there is, when the negative growth impact is going to be higher, that means there is going to be more employment. And in our kind of countries where there are current account deficits and FX debts, indebted companies, the FX volatility, foreign exchange volatility is also an important factor that needs to be taken into account. So it all depends, I think. The negative impact is there. It is a negative impact. When in the past, when we have sudden stops, we go and analyze the usual suspects. It's either some government policy, some irresponsible government policies that are leading to that result. Some mismanagement in the economy could be the major issue. But in this sudden stop, it's the virus. As Fed chairman mentioned last week, I think, or the week before. So it's the virus and not the usual suspects this time. If there were previous arguments that there were some usual suspects, that doesn't mean anything now. all the countries, all the developing countries especially, or all the emerging countries are now equalized by the virus. I mean, we need to forget what happened before. We need to focus on what we are going to do from now on in order to contain this damage and focus on the measures to create a kind of a new global cooperation in order to deal with this issue. Because I think if this process is, if this duration is going to be longer, then the impact in developing countries, in emerging countries, not only in low-income countries, are going to be devastating. And I think we are in a situation where we are going to lose all the gains from globalization in response to the Millennium Development Goals. You know, so many people came out of poverty as a result. I think we are in a process where more than those that came out of the poverty is going to get into poverty once more. So that's why there is the need for, I think, G20-based global cooperation to deal with the situation in the developing countries. So let me stop here. I can answer questions.
I will take the advantage of being the moderator and start with the question. And this is actually a twofold one, for both of our speakers. And this is about the economic impact you just mentioned, Professor Sak, that as long as the duration continues longer, the situation, the economic impact will be more. And this brings us the question of normalization. And Professor Ergönül, how should social distancing at workplace look like? And for the Professor Sak, and would that be enough for the economic improvements? For instance, like the flights, it's discussed that the seating will be rearranged, and would that be enough for the companies, airplanes, to gain any profits?
Okay, maybe I can start to talk about the arrangement of the workplaces. In fact, this new era is called as new normal. New normal is not like the situation before 2020. So therefore, it is something in between. And that means all the companies now, including the hospitals, laboratories, which are already the healthcare sector, trying to adapt themselves to the new normal, which means decreasing the density of the population in the work, distancing. And then in order to create this social distancing, you should decrease the number of your workers, your officers, whatever, whoever, and then try to put a distance between them, at least about 2 meters, for instance. So therefore, also including the cafeteria and working places, and also the shuttles, maybe service, that kind of services as well. So in fact, this also depends on how the immunity will develop. So this is what we foresee in next few months, up to September, let's say, in next 2 or 3 months. We can say that such social distancing measures will be implemented. And that means maybe the halving the number of the workers in some factories or in working institution workplaces. So if you look at the measures against the COVID-19, distancing is the number one. The second one is hand hygiene. And the third one is using the mask. Of course, using mask is related with, again, this distancing. If you get this distancing measure safely, confidently, then even you may need to use a mask, but it is not possible most of the cases. And in workplaces, also in gatherings, etc., you can use mask. But it is not necessary to make a strict lockdown for the workplaces. The workplaces and the cities can be open. That already Italy started for that one. And here another measure is decreasing number of the cases, decreasing number of the deaths. And all the curves in Europe is going down now. So we are at the declining side of the bell-shaped curve. And the numbers are decreasing. including Turkey or other countries. So here, but still few months, we will settle the social distancing using masks and increasing again hand hygiene facilities. Increasing hand hygiene will be sustained in, it's important every time, not only in the pandemic, but the others are not easy to implement. They are sometimes boring and annoying to people using the mask, for instance, and these are the summer months are coming, so it's not easy. But therefore, I'm emphasizing on the social distancing as the more important thing. I don't know how the administrators and managers, we are also consulting many companies, how they are going to do. They are trying to calculations to decrease this population density and create distance. This is the things that we can do in next 2-3 months.
Thank you, Önder Bey and Güven Hocam.
So, I mean, in order to answer this, we need to answer what normalization means. Normalization, for me as an economist, is for, let's say, for the consumers to go back to their old consumption baskets. You know, in the old consumption basket, for example, if you look at our GDP statistics too, around 15 to 17%, let's say, for transportation, including airlines. Then around 10%, the hotels, staying at the hotels. So there are many, and restaurants, there are many items in the old consumption basket. Now, we are not there. Returning back to the old consumption habits, the old shares, let's say, in our consumption baskets, I think is going to take some time. Because as long as we are going to have social distancing in this period, it's not, so we first have a period where we have been trying to control the spread of the virus. Now we are going to be in a period where there is going to be a kind of a process towards, let's say, normalization. It's not normalization yet. So in this, let's say, interim period before normalization, it's not possible for the consumers to go back to their old consumption habits because of the fear of losing their lives because of the virus. And also, it is not going, for some of them, it may not be easier to go back to their old consumption baskets because of the negative income effect also. So the importance issue, I think, what we are going to do in this interim period, there is going to be a kind of a respacing everywhere, because these spaces that we are using, the universities, town halls, even the cities are not designed by taking into account social distancing. So when it comes to, for example, buses, with these new measures, in the past we know that, let's say, one driver and around 45, 48 passengers in the bus. Now it's going to be one driver and around 10 to 12 passengers in the bus. So it's going to be, again, for the companies too, it's going to be a very costly period where the operating capitals need to be increased, need to be strengthened. And I think this is going to be an interim period where more people are going to lose their jobs. So this interim period that we are in, and Darby said about 3 months, that's what I understand. And as far as I understand, he said that we'll see the situation in early September. So we'll see the situation in early September. Still, there is uncertainty in terms of going back to our old consumption baskets. And that means there is going to, this is going to be a period where livelihoods are going to be more important rather than focusing on the economic, reopening the economy totally, because it's not possible. Even though there is going to be a general order saying that now you can do whatever you would like to do, I don't think the consumers will go back to their old habits very quickly with the virus around. So I think we are in a period where that, and I think that's precisely why this concern regarding developing countries is developing in all the centers, now in Washington too at the same time, as far as I see, that the impact of the virus on the economy needs to be controlled. Otherwise, there is going to be a more detrimental impact on the international monetary system at the end of the day. So we'll wait.
Thank you, Güven Hocam. And there's also a follow-up question on this, exactly on this topic. And this is also about the consumer behavior. This is from Akif Türkel. And he asks, do you expect humanity will abandon luxury of traveling all around, such as a short weekend trip to 3,000 kilometers away touristic town?
Yeah, that would be nice, of course. That would be nice. Let me answer this in this way. You know, in terms of the mega trends that we have, I think one item is going to become more important. These climate change issues are going to become more important because this virus, we don't know it, that the virologists are going to tell us how it came out. And there was a discussion just yesterday or the day before at the World Health Organization on opening a kind of an investigation for how this virus, you know, transferred from animals to the human beings. I think when we are going to see at the end of the day that this issue of, you know, our way of living is creating this virus. So the impact that's creating the climate change problems is creating this virus-related or pandemic-related issues to us also at the same time. But let me answer the question directly after that. I think it's going to be very costly to travel by a plane in the coming few years, as far as I see. Because if you make the same comparison with a bus, if it's going to, you know, you only need to have 20-25% of capacity, passenger capacity to fly a plane, like in a bus, then it's going to be very costly to travel from one place to another.
Thank you. And there's a question for Professor Ergönül, and this is from Kadri Taştan. How would you evaluate Turkey's fighting coronavirus from a global perspective?
I think the Turkish situation, the situation in Turkey is much better, I think, in terms of fighting against the coronavirus. Why I'm telling this? Because our hospitals are not oversaturated. And now the numbers are decreasing. The newcomers are much less nowadays in all hospitals, not in our hospitals, but in all over in Turkey. And the intensive care units were not oversaturated. The problem in Italy, Spain, or France, there was no place for the patients in the ICU, in hospitals. Their hospitals beds were not enough. Therefore, the case fatality rate was too high because of those reasons. Many people, also in New many people died in the emergency departments while waiting their line to be admitted to the hospital. We never lived such a scenario in Turkey. And this might be because of the enough number of the hospital beds, as I said, and the quality of the healthcare workers and their dedication, in fact, I can say. Really, we should say that the healthcare workers work very, you know, in a very concentrated way, long times, long hours. And they were like accepted as heroes all over in all the global level. So because of all these reasons, and also the universal coverage was an advantage. Nobody was went out from the emergency, etc. They were all placed in the hospitals. Of course, we lived some hard times at the beginning of April and at the first few weeks in April, but it took only few weeks. if you compare this with the Western European countries, Turkey was much better. I mean, also we can see this under European Society of Infectious Diseases. This is a good thing. Turkey should be proud of it. This is true. I mean, not only one party, whatever the government, but overall Turks in Turkey, they should be proud of their measures because they did very well compared to many other things. There might be one thing. The case fatality rate is 2% in Turkey, 3%. You may ask, someone may ask, Turkish government Ministry of Health is reporting only the definite cases. That means the positive PCR results were reported. In some countries, besides that one, they also report the suspected cases. So even if you include the suspected cases, you can double the case fatality rate, which makes 4%, let's say. Still, it is much low. It is much lower than 10% or more. And then, therefore, I found Turkey because of many reasons. And one other reason is we are having maybe younger population compared to Western European countries. This is another point. And some of the public health measures were taken much earlier, more timely. That was another point. Our schools were closed much earlier. And because we were afraid of mainly Iran, not the Western countries, but there was an Iranian wave at the end of February, at the beginning of the March. So we were very scared about that. And also pilgrimers from Saudi Arabia were another threat to Turkish health system. But overall, if you look at the numbers, etc., Turkey managed very well. I mean, one of the good ones, good countries, I can say. If you compare to Germany, South Korea, Singapore, they are the best. And then right after them, I think Turkey can come.
Thank you, Önder Bey. And exactly, you just listed several points that why Turkey was lucky, that timely measures and younger population. But there is one specific question about that. This is from Thomas Siebert. He's from Der Tagesspiegel. And it's, again, the question of, you said Turkey was lucky. Can you give some examples for that? Would you have any more examples of this situation?
Why Turkey is lucky? Turkey, well, another point, well, there are sometimes some points that we criticize in the past could be an advantage. This is the life and history. For instance, another one, there was a problem in diagnosis by PCR, not only everywhere, it was a global problem, because the PCR test sensitivity is about 60%. That means you are sick, but only maximum 60% you can be diagnosed. This is the nature of the problem, bottleneck of that test. But in Turkey, we used a lot of, overused the computerized tomography for chest, for instance. That was interesting. And China did as well. So we could be able to diagnose most of the patients by using computerized tomography. But in the past, we criticized that we are overusing the computerized tomography because of the radiation risk and even the magnetic resonance. These are the imaging techniques that in Turkey, we have high consumption of the antibiotics and high consumption or overuse of these technological tests. This was our criticisms before the pandemic. But this time, we took the advantage of having too much computerized tomography. This turned out to be an advantage because since the virologic test was not working well, we diagnosed the patients by using the CTs. Its sensitivity was much better than the virologic test. So then we could able to track these patients and replace them to the hospitals and treat them. That was an interesting advantage that we are going to write about this story in the medical time. Because we know that in Western countries or Northern European countries don't use too much that kind of tomographies. This is one of the examples.
Thank you, Önder Bey. Just for our audience to know that Önder Bey will need to leave in 5 to 10 minutes and we will conclude in 10 minutes. So you can still submit your questions, but please quick if you want to do. And the next question is from Lena Zimmer. And I believe this is better if Güven Bey picks this up. Could you elaborate on the impact of COVID on refugees in Turkey, Syrian and non-Syrian, and availability of disaggregated information on these groups? I know that this is not exactly your topic of interest, Güven Bey, but it's great if you can address. And if you can just speak closer to your microphone, that would be great. Thank you.
Okay. Regarding, you know, as I said at the beginning, the economic impact of COVID-19 is, we are going to see that it's going to be the worst for the developing countries, and it's going to be worse for the vulnerable communities also. So the refugees are also part of that vulnerable groups when it comes to Turkey. And it is possible to make a few comparisons, I think. For example, the household size for normal Turks is around 3 or 3.5 people in one house. For the refugees, that's around 5.5 to 6 persons, so more crowded places. And they are doing, they have been working on odd jobs. It is not possible to continue many of those. And also, thirdly, when it comes to Turkey, does not have a very strong social safety net dealing with all the population. The measures that we have taken are very much related with the previously employed people. I mean, by using the records of the previously employed people, already employed people, so the lucky ones. When you have more odd jobs, it's not that easy for you to find support, but still there are mechanisms. There are, let's say, not well organized support schemes in the country. But when you look at, for example, there is also the need, for example, in the last couple of years, the migrants, the refugees in Turkey have been working for as agricultural workers too. So there is a circular migration inside the country. Then first we had some difficulties in Antalya and also some provinces to take the refugees to those places. But I think then measures were taken to allow the refugees to go to those places to continue this circular migration thing at the end of the day. But you know, overall, there is a negative impact, of course, on the refugees, as they are one of the most vulnerable in the country.
Thank you, Güven Hocam. There is a question from Santiago Mondragon, and it's open for both of our speakers. Have the reaction and measures implemented by local authorities helped to control the pandemic?
I can answer maybe first in fact, all the measures were okay. Sometimes at the beginning it was a bit late, I think. It could be much earlier, I can say, for some of the tests. And transparency would be better in Turkey in terms of the local authorities. Still, if I would be the, let's say, responsible for that, I could be more self-confident, because there are a lot of reasons for Turkey to be more confident, more self-confident, and there are a lot of reasons for Turkey to be proud of. But we don't see this, kind of behavior that still, then it should be transparent, for instance. I mean, if you are confident or self-confident yourself, you are more transparent, and you are, there is nothing to, that you should hide or you should not talk about, etc. We don't see, sometimes we can see this, and the reactions were a bit delayed sometimes because of this lack of self-confidence, I can say. But otherwise, there is no need to have such a lack of self-confidence, because this was global problem. Every country has this problem. Secondly, Turkey is doing well. I mean, and Turkey was lucky in many aspects. And one of the addition to the former question, Turkey was lucky because Turkey lived all these things a bit later than in front of Turkey. We already have the examples of the Western European countries, that the dramatic pictures that we have seen. Therefore, Turkey was quite lucky and managed very well after this.
Thank you. Would you like to add something, Güven Hocam?
No, I don't have much to add, really. I mean, but I can only say that, you know, we were so overwhelmed by this thing at the beginning, and we were so unprepared, let's say, all of us, so unprepared in reacting to this. I think this is a kind of a learning by doing process for all of us. Maybe at the hospitals, the doctors first realized the importance of the issue, but it took all the other, you know, measures, all the other authorities, they needed some time to adjust, as far as I see. And regarding local authority, this is an urban problem. This needs to be managed at the local level. But I think our local infrastructure, let's say, is not that strong. Turkey is a very centralized unitary state when compared to other unitary states. So I think we have a problem in designing local support schemes. But despite that, all the you know, livelihood support systems that we have are at the local level also at the same time.
Thank you.
That. So,
thank you. We have a question for Professor Ergönül, and it's from Barçın Yinanç. Did Turkish doctors have more flexibility in using different equations of medication compared to their foreign colleagues? And also, are Turkish doctors have ways of sharing their experience with the world sooner rather than later? It's said that Turkish doctors need permission from Health Ministry to publish their findings. Is that true?
Yeah, thank you for these questions. First of all, lots of different drugs were used, but this is not an advantage because none of these drugs were working well. No one can say that we used that different drug because that was useful, etc. Only we can talk about some anti-inflammatory drugs and few antivirals. I mean, it was not a richness, it was not a strong part because of the lack of the effectiveness of many other drugs. For instance, hydroxychloroquine was also used in Turkey, but it was not working, basically. And secondly, for the second part of the question, the scientific research, yes, Minister of Health put the barrier, let's say, up to the ethical committees. Normally, like in every country, Turkish scientists or Turkish physicians, if they want to make a research, they have to apply for ethical committees or institutional review boards. Each institution has such a review board, and then that's enough. Normally, all these institutional review boards are connected to the Ministry of Health or related bodies in the government anyway. But this time, another permission system was set on top of this mechanism, and all the researchers will need to get a permission from the Ministry of Health. They said that this was done for good wishes, good wills, etc., to organize better kind of things. But as far as I have seen, this is just objectively, I will talk about that. My colleagues were not satisfied with these explanations. This is, for instance, Turkish Medical Association published or put a very important point, and all the other physicians are not convinced that such a system is for organizing, but such a system was put somewhat because of any reason. We don't know, still we don't know the reason, to put a control for the scientific studies. And then what is the outcome of this measure? It decreased the scientific productivity, basically. If Turkey, this is a contradiction, if Turkey proud of making such a good progress in terms of the healthcare, then why don't you publish this? This is the publishing these results. Publications are the most important visibility in scientific environment in the global level. So why do you suppress that? I mean, you can easily be proud of what you have done. So this was the point that I also expressed my thoughts in the press or media as well.
Thank you, Professor Ergönül. There are two follow-up questions on Turkey's handling of the situation, but we have 2 minutes and I will just read them, and if you can brief about with your answers, that would be great. One is from Özgür Ünhisarcıklı, GMF's Ankara director. He asks, can you please identify best practices in Turkey that can be useful in other countries as well? And the second one is from Jasper Mortimer. I have also been impressed by Turkey's handling of the virus. Turkey and Canada have roughly the same death toll, but Turkey has more than twice the population of Canada. But there is talk in the medical fraternity that Turkish state hospitals seriously undercounted the virus fatalities. You touched on that. Can you please elaborate? Were state hospitals under government pressure to pass off virus fatalities as pneumonia fatalities, for example?
Oh no, I mean, Turkish, actually what I'm proud of, the Turkish healthcare workers, for instance. I mean, the Turkish manpower in healthcare is really the point that we should be proud of, and their flexibility, their dedication to work, in fact. We don't have any hidden numbers of the deaths in our hospitals. And many other countries also reported only the definite diagnosis. That means confirmed diagnosis, confirmed by the virological tests. So therefore, we don't have any dramatic, catastrophic scenes or pictures in our hospitals. People, of course, get burnout and worked a lot, and the healthcare workers, etc. But the situation was okay. It was good. What was the first question? The
best practices Turkey.
Okay, yeah, there are two things. I mean, we have mainly two important drugs. One antiviral that we use, favipiravir in Turkey. There is no remdesivir, for instance, in Turkey, but we have favipiravir. This is a Japanese drug. It is used widely. I don't know how it was effective because we don't have any scientific report yet about the effectiveness of the favipiravir. Secondly, we use tocilizumab widely. This is an anti-inflammatory drug that's also used in the rheumatologic diseases. I definitely believe in the effectiveness. We already prepared the report. We are going to publish this in a scientific paper, and like our colleagues in European countries. So two important drugs were significant in Turkey. And Turkey didn't suffer from lack of drugs. This is important, I can say. But I'm not talking about the hydroxychloroquine or many different kinds of nonsense drugs. But favipiravir, an antiviral, and secondly, anti-inflammatory drug tocilizumab were useful.
Thank you very much. And with this, it's time for us to conclude. And there is nothing much to say that we will wait and see. I want to thank you, Professor Ergönül, and you, Professor Sak, for joining us with your invaluable comments. It was a privilege for me to moderate this session. And also, I would like to thank my colleagues, Özgür, Kadri, and Alberto, for their support. And of course, to our audience for joining us today and taking the time. And for some reason, if you missed a part of this session, it will be posted on GMF's website and also on GMF's YouTube channel right after this session. And for the future events, just for you to note that the month of June is especially important for GMF because this year's Brussels Forum will be organized through a series of virtual discussions, beginning with June 2nd. And in order not to coincide with the Brussels Forum sessions, we will have some pauses for these on Turkey conversations. We will keep you posted on our upcoming work. And with that, thank you all and happy Friday.
Thank you very much.
Bye-bye. Thank you.